my channel. I hope you are having a wonderful day today. So, as I have said before in my videos, that in my next video I was gonna talk about my clinical experience, some of it. So, today I am gonna talk about my clinical experience for first year. For our first year, that was in 2019, it was interrupted by the pandemic, so it was not completed, but we did clinical rotation for a few months. We did our clinical rotation for nursing foundation in Baripur super specialty hospital. As our college is a private hospital, we rotate every year to different hospital for different fields and different subjects. So for our first years, uh, for us it was the Baripur super specialty hospital. But the first day that we started as student nurse, it was a really memorable day. We got to got together at the bus, and we went to the hospital for the first time. For all of us, it was first experience, and we were nervous and excited all together. So when we arrived at the hospital, we were assigned a tiny room to keep our bags and stuffs, and it was really chaotic the first day. And we got to put on our white aprons for the first time, and it was a really memorable day for us that day. For us, when we did clinical rotations, we have to go and sign for our attendance. At that time, we signed that we were present at the day. It was the register was put in the OPD. I think, as I remember, it was put in the OPD, and the staff nurses were there to monitor that we do not cheat on the signing of the register. And yeah, it was scary at first because it was our first time dealing with patients, and there are diseases that we didn't know, and everyone has stereotypes. Everyone is human too. Everyone fears something. But as we were student nurses, and our teachers were really good guides, so we got together and we did the clinical rotation without any uh, without any incidents, I would say. mm, Small incidents happen all the time, like you get scolded, you do something wrong because it's the first time, but that's normal. For our first year, we did the basic procedures of nursing foundation chapters, and the clinical rotation were mostly based on general wards. We didn't get to the surgery wards or anything. Mainly female and male uh, wards we were going for rotation, and at that time the Baripur hospital was uh, redeveloping, so the building was really clean and stuff, and we didn't really expect the government hospital to be that clean in Kolkata. But we get to experience a much more cleaner environment in Baripur hospital at that time, and I think it was good for us because we get to experience our first time in a much more clean and organized buildings. And at that uh, at that time, and still now, any kind of phones or electronic gadgets are not allowed in clinical rotation. So there are no photos or videos that I can show you guys at the time of our rotations, but it was fun with friends doing the rotations, going to the patient, taking histories, doing physical examinations. The clinical instructors were always there. They gave us homework to do, like you have to do this procedure tomorrow, you have to take the history of the patient, tell me the history of the patient. Yes, the as a first year, uh, the first thing you learn is to give history to your instructor. And it was a nightmare for all of us because our instructor told us you have to take detailed history and tell us the morning history, and we didn't know what the hell was the morning history, but we tried and we were scolded. Yeah, it's part of the procedure. You have to be scolded to know what is right and what is wrong. So at that time, we learned how to take history for I think a few weeks at first, and then we learned how to give the history in English because uh, in BSc nursing, English is a mandatory language, so you have to give history in English. For many of us, it was a little difficult because not all of us talk in English all the time, or not all of us are from English mediums. But it was fine. Everybody learns, and everybody has to learn for the profession. So we learned how to give history to the instructor for I think a few more weeks. After that, we did bed makings or personal hygiene maintain of the patient, that kind of procedures, like bed bath or all the normal procedures. I don't know nowadays how the clinical rotations are done because it has split into semester wise rotations. So the new season student nurses are starting I think this week or next week, as I have learned. So I will say good luck for your clinical rotation. It is difficult at first, but it will be exciting really as time goes by. So as I stayed in hostel for my whole first year, although it was not a whole year for the pandemic, but yeah, I stayed in the hostel for my first year, and it was a really, I think it was really a necessary experience for my personal growth and everyone's personal growth. The experience in hostel is much more difficult than we originally think. Like we think we are strong and we can get together with friends, new friends. We'll make new friends and we can stay in the hostel. But for first timers, it's always difficult to get accommodated in the hostels because you are away from your families, and for our hostel the phones were not allowed, so we couldn't really talk to our parents until 9 p.m. Every night, and some of us were mentally not ready for that. But if you are going to a new path in life, it is always important to know that the path will not be easy for you. And yes, everyone understood that after a few months or two, and it was nothing we can do about it. Yes, so in hostels, we got back to hostel if we had clinical rotations. We got back to hostel at 4, and if we had normal classes, then it was 5, or if external lecturers were there, it can be 6:30, however much the teacher was willing to spend on the class. So as I was first timer in hostel, it was really difficult for me to get up to a schedule in at that time. But if now I think about it, in my first year I should have planned a much better schedule for myself, because it helps in everything, I think. In my first year, it was exhausting to do all the work from 9 to 5, or if we have clinical rotation, then we have to get up at very early morning because we have to queue in line for the common shared bathroom. That is the main difficulty of any hostel in West Bengal or anywhere, I think. Queuing in line for bathroom, it is hectic. Like it is a war going on between the girls. So yeah, we have to I our room with I have 5 other roommates. we got up really early, like 5:30, to go to the bathroom because that time everyone was sleeping, and mainly the bathrooms were empty, and we had to take a bath and stuff. And even when during winters we did get up really early, like 6 a.m. like most of us, not all 6 of us, some prefer to wait until everyone was done, like around, I think, 7, because our bus was really early, 7:30. It leaves 7:30 in the morning for clinical rotation, so we have to be ready at that time. After doing bathroom check, we have to eat and then be ready for the day. So yeah, the morning routine was never really a routine for any of us, and it's really difficult to keep a schedule for the morning preparation in hostels, of nursing hostels mainly. So no one expect you to keep a chart like I will do this time, I will do this time. Yeah, but after the long day, like when we got back to our rooms, like if it is 5, then it is a good time, because at that time we have snacks, and after then we relax, because yeah, we are studying all day, no one is gonna study all the evening too. And in our hostels, because phones were not allowed, so we generally gossiped and talked among ourselves. As I said, we are 6 roommates together, so it is a really good bonding time. But now I will say that in my first years, we didn't really leave our rooms after college hours, and we kept to ourselves, and that was not really a good thing, because we were all from different places, and we kept to ourselves, and we thought the other rooms girls were maybe not nice, maybe we shouldn't take chances. But I think we should have taken the chance and befriended them at that time, and it would have been easier for the next 3 years, I think, because the friendship you build at the beginning of this journey is gonna last forever. Because I have gained a family of 58 students, I will say. The picture behind me is our group photo of our groups, all 58 of us. I will say I have gained a new family at that time, and I will never ever forget that family. And if we have started much earlier, I think the deep friendship that was built among us would have been much deeper at that time. Most first years are really afraid of becoming friends with others, because no one knows anyone, and it's okay, because you are new, everyone is from everywhere, and everyone is afraid. So go ahead and talk to them, and maybe they will become your soulmate sometime, and you will never know which friend you will inspire in your life. And yeah, the hostel experience was really fun at the time of our first years, because we did a lot of bad things and good things also. I will not go into that. It was a huge mishap we did in our first year during the COVID pandemic, and we got a name for it too in our college, and it was not good. It stuck to us for 4 years, and we regretted it a lot, many of us. But we did what we did at that time, and we were really young and new to this, and we didn't know what we were doing. So yeah, the first year went by rather quickly for us, but the teachers helped us a lot during the online teaching classes. They taught everything possible. They taught us, and after the pandemic holidays, when we got back, we did our practical the procedures that were left behind in the laboratories of college provided. the laboratories are really advanced, so it was not that difficult to cover up the rest of the procedure for us. But yeah, we would have preferred the clinical rotation in actual hospital at that time, but the exposure was not really there for us. The opportunity was not there for us, and we couldn't really do anything about it, neither the college nor us, as the COVID situation was going on. But I would say the clinical experience of my first year was really memorable because the things we learned at that time through our clinical instructors were never forgettable. I will never forget the days that our clinical instructor taught us hand by hand how to make a bed, how to do a proper bed bath, how to properly care for a patient, how to talk to a patient that the patient thinks I am a good person, and he or she can share uh, their information with us, that like their medical histories or their personal histories. A lot of the time when we talk to the patient, we are not confident enough to really talk about it, and the patient feel like I shouldn't really tell them this. So the history taking is very much important step to learn in your first year. I would say if you are starting your clinical rotation, the first thing you should learn is how to take history. And if you are trying to take good history, then you have to know how to communicate with the patient. As we are all I am from Kolkata nursing college, so the Bengali is the main language here in all government hospitals, but you will find some Hindi speaking patients also. So as it is our mother tongue, it is easy for us to communicate generally. So you have to be enthusiastic when you are talking to a patient, because they are a patient, and they are here there for treatment, and they are expecting something from you. So you have to be patient when talking to them, and get to know them. You have to get to know them so that they can share their information with you with trust. You have to build the trust when taking the history. And I would say when doing the history, you have to learn gradually how to do physical examination also, because it is the most general and simplest part and the first step of patient care. So first you learn how to take history, and then when you are comfortable with communicating with any ill patient, you have to do a physical examination when taking the history. And when doing the history, you can do a general checkup through eyes, like seeing all the things, however you are taught in your colleges. But yeah, I think history taking and physical examination should be done all together at the time. But if you are just starting your clinical rotation in hospitals, then learning how to take history is should be done it in hostel rooms, because it is the most effective way to build your confidence with your friends. We did that at that time too, and it was really helpful. You have roommates, of course, if you are staying in hostels, so do a little role play, like your roommate is the patient, and talk to them like how you talk to the patient, and it really helps to boost your confidence a lot. Even if you are talking to a friend, it changes the way you talk to a patient, and you learn what you should ask and what you should not. And it is really difficult to know that where you should not cross a boundary when talking to a patient about their personal information. So yeah, this type of experience you can get in the hostel with your friends, and use the time with proper planning, I will say. If you are staying in hostels, then time is really crucial, because most of our days gone by with clinical rotation and classes, and there are lots of notes and books to revise. But yeah, if you are staying in hostel, the after hours of your college are really important. I know that for first timers it is really difficult. It was difficult for us too, but because we didn't have access to our phones at the time in our first years, I would say that we got a lot of time to revise and study and focus on our general materials of the part of the education. And it was the best choice a college could have made. Now I will say, many of you will say because I have already graduated, I have already left the college. I am saying this, but if you have experienced that, then you will also say that it is really important to get up and study. But now, as we all have phones and gadgets, it's becoming more and more difficult to leave them alone and go and study. So I would say I am grateful to my college because uh, they denied the access of phone, and it helped us to more focus more on the education part and building friendship and bond within our classmates. And it was a fun experience, I would say now. But don't be afraid to just put your phone down and get up that book, I would say. I know I am not any expert in this field, but yeah, I said I will talk about my clinical experience, but I talked a lot about the hostel experience also, because as a nursing student, your experience is uh, always together with the hostel experience if you are in hostels, because that is the most fun part, I would say. And it was also for me the most fun part also for the 4 years, although I didn't stay in hostel after my third year, uh, but I didn't regret it at that time. So to all of the students who are starting this year, I will say congratulations and best of luck for your clinical exposures. It will be fun and exciting, I promise you, and it will be a great experience for all of you. So, thank you for watching and listening to my rambling at that time. If you have any questions regarding how the clinical experiences goes for any nursing student in Kolkata, or if you have any general question, you can ask in the comments. Thank you for watching. Please subscribe to my channel if you are liking my channel. In the next upcoming videos, I will talk about my experience in the rest of the years and the hostel experience also. So thank you for your time. Bye.